สวัสดีครับand welcome to Dharma in Motion. I'm your host, Kan Kitiwet. Now, new findings in modern medicine, interestingly, have drawn us closer back to the teachings in Buddhism. Now, in this edition, we'll have a chat with someone who delved into the subject of medical science in relation to Buddhism. He is the professor of clinical medicine, Washington University in St. Louis, USA. Now, Dharma in Motion warmly welcomes Dr. Kongsak Tanphaichit. สวัสดีครับ
สวัสดีครับ
Well, very good to have you here. You recently hosted the symposium regarding the Buddhism and medical science. You did mention that the precepts observed by the Buddhist monks clearly reflects the Buddhist wisdom on preventive medicine. How is it so?
The Buddha forbid the monk to urinate or defecate, even spit in the waterways. And you have to wash your hand after you use the restroom, which is very much into it in modern medicine about preventive.
Precepts are actually very close in relation to the practice of modern hygiene.
Exactly. They like you go to the hospital, sometimes they let you wash with alcohol or wash with the soap for 2 minutes or so. And the reason is because like when you urinate or defecate, you might pass on like parasites or virus, bacteria like E. coli, cholera, Vibrio cholera, or giardiasis. And also like when you use the utensil, you have to overturn it so that there won't be any mosquito to lay the eggs and cause malaria. So one time, one of the monks forgot, and then there was a big deal about it. And there was a fight within the group of the monks because of this. And the Buddha has to leave to the forest, like the Pangli Lai, the elephant and the monkey brought him food because he couldn't stop the quarreling. And finally they come to ask him for forgiveness because people stopped giving arms around anymore, stop giving food. So it become one of the postures that you see, the Buddha Pali Lai, with the elephant and the monkey giving banana and sugar cane.
Most of the teachings of the Buddha himself, with the discoveries in modern medicine, we have realized that there are universal truths which still are applying here and until today, and more findings are made with modern science, and we see the truth in Buddhist teachings.
Exactly. They found like Buddhist monk who meditate 10,000 hours to 50,000 hours. They use Tibetan monk, His Holiness Dalai Lama, offer like 8 monks from Nyingma and the Kagyu Institute to participate in the study on the brain, and they found on the functional MRI and PET scan that this monk, his brain lit up on the left prefrontal lobe, which is linked to a happiest person. And normal person would lit up on the right side. So it shift gear this is on meditation, on compassion. So that way it would be non-denominational, so it would be universal. And it turned out like this monk, not only that, they try on the white-collar worker to train them on this mindful meditation and also lit up the left prefrontal lobe in the front here. And when they give them flu vaccine, people who lit up in the left prefrontal lobe have double antibody response and the control who didn't do any meditation. So
Also,
it's
meditation
very exciting.
Also adds to the benefit of vaccinations.
Exactly.
Increasing the immune system. One of let's give an example. Sometimes year to year we would have influenza vaccine, and those who meditate would have a better immune after receiving the vaccine.
Right, it's been proven in the same study.
Oh, interesting.
This monk also have a high frequency brain wave, with gamma wave, which is about 90 to 100 hertz or cycle per second, while normal daily life is about 38 maximum, like daily living. So you can catch a thought that way, because the mind is quicker than your thought.
Maybe on the sidetrack here, how do we measure the brain activity nowadays?
They use EEG to see, like normal person would be in the beta range, which is like 13 to 38 hertz. But this group of monks is in the 90s.
On the subject of Buddhism and health, science of the mind and mindfulness, we would be discussing that perhaps in the later part of the break. But let's get to subject regarding physical health care in this first half. But before that, what brings you to show to have interest in Buddhism and this subject? You have medical training, of course, from Surat originally, and then you travel abroad to do more studies and work. When did you start discovering these truths?
I always interested in Buddhism since I was a child, and through studying Tripitaka, the Buddhist canon, their description of good and bad patients, good and bad doctors and nurses, it's in there already. And also, the Buddha, like one time when he was old, Ananda, which is his personal attendant, spot that he's getting a little old, and he asked, how come your complexion is not so shiny as it used to be? And your back is start to curl forward, and you start to bend forward, and your eye, your ear is not as sharp. So
what age was that?
He's in the late part of his life.
Okay.
He lived to be 80, which is above
Average.
the average of American currently, which is only American male is about 75 nowadays. So he even lived longer than that. And his answer was shocking because he said, in youth, there's aging, okay, and there's life, there's death. In health, there's sickness. When I emailed this to my friend, and he forwarded to his researcher friend in Chicago said, how come the Buddha know about apoptosis? Apoptosis is about programmed cell death, that each cell is programmed to be dead, like say skin cell may live to a week, red cell live 120 days, and nerve cell may live throughout your life, so there's no replacement when you get Alzheimer, dementia. So this proved like it's matched with the current finding nowadays.
New findings and more experimentation in medical sciences, especially regarding the regeneration of cells using stem cells, perhaps might even prolong our lifespan to another decade or two, which is quite interesting. The Buddha also set standards in caring for patients. How is that so?
One time he saw a monk who was very ill and lay in bed in urine and feces. So he personally took care of that monk, and basically he set example for other monks, said you all should take care of your peers who are sick as if you were taking care of me. So it set a good example for them, and they start taking care of each other. So the ladies start to build infirmary for them, like for people.
So
sick
it's
monk,
more like the
sick
first
monk.
establishment of hospital wards.
Subsequently, about 250 years later, Asoka the Great, Asok Maharaj, he used that as an example to set up hospital, not only for human, for animal as well. So that became the first hospital in the world recorded. He also emphasized on the benefit of brushing the teeth, say it will give you a benefit and the harm of not brushing your teeth. The description about you will gain your food would taste better, the taste bud become clean, so become healthy, and so on. So it's very good. He also, one of the king, he lived in Sravasti or Savatthi for 25 years. It's the most powerful kingdom at the time. And the king, Pasenti Koson, he was very obese. So, but he worship almost respect the Buddha so much. He would kiss the Buddha's feet and bow down. But you know how obese person.
It might be a little difficult for him.
So the Buddha spot that. He said, a mindful person a person who is always mindful would be moderate in consumption, and then so you would feel good about it, and longevity is to be expected, and so on. So, and he said, personal attendant said, "Come here." His niece, his nephew, I'm sorry, said, "Write down what the Buddha just recited, and then you, every time I put food in my mouth, every time I eat, make sure you recite that poem to me." And so shortly afterwards, he lost a lot of weight, become healthier. And he said, "Oh, the Buddha gave the teaching which not only beneficial at the present moment, also into the future." So, and that king lived to be 80 years old, as long as the Buddha. Because there was one sutra that said, "You are 80, I'm so 80 years old." And so we know he lived to be 80 years old.
This realization of discovering the middle path doesn't come easy even for Buddha himself. He lived to be, as you said, 80 years old, but also in the process of finding out the truth, he endured all those rigorous torturing to himself in the process.
Self-mortification. It took 6 years in that, and he lived like luxurious life for 29 years as a crown prince. And then obviously during that 6 years, he also meditated into the concentration meditation, the highest mental absorption, 7 and 8 jhana, under the two masters at the time, Alaradabut and Uttakadabut. So he learned about the tranquility of concentration meditation, which is more tranquil than his royal life. So he's stuck in the sensual desire and self-mortification, too extreme. So when he gave the first sermon, Dhammacakkappavattana Sutra, setting Dhamma wheel in motion, he said you should walk the middle path, avoid the too extreme. And that's also, he denied the eternalism or nihilism, which is another belief in the time. Say life can go on forever, there's this permanent soul, which he said, no, it's a soulless. It's a not self, no true soul that live on forever. And he also denied nihilism, which said there's nothing left after the end of this life. So
with the Buddha's teaching, did he mention right back then about the concept of reincarnation and the soul, each individual's soul learning step by step in each life?
There is a belief in the old Hinduism which is called Brahman. They believe that like you live like you wear different clothes in different lives. So the same guy keep on going. But the Buddha said it's no true permanent self to begin with. Like even when you're born and now, even yesterday and today, we are different. As we know, cells are different. We have to take chow every day. Our belief and our soul change all the time. So he said, it's impermanence, imperfection, and not self, which are the three universal characteristics of existence, which also form the basis of Buddhism in the First Noble Truth about because we cling to the 5 aggregates of clinging that are suffering, which is the First Noble Truth. He said to be born suffering, to age is suffering, to die is suffering. Depart from your loved one is suffering. Physical ailment, mental ailment are suffering. Sorrow, lamentation are suffering. Didn't get what you want is suffering, and get what you don't want is suffering. He said, in short, the 5 aggregates of clinging, of body, feeling, perception, thought formation, consciousness, are suffering when you cling as self. So anatta, or not self, or sunyata, voidness, emptiness, are unique to Buddhism. No other religion teach that.
Let's get to the atmosphere at the symposium you recently hosted. In that, there are certain segments that you mentioned about the Buddha's description of the origin of life, and also fetal development and aging. That is the truth that he discovered and preached back then.
Like
the stages of fetal development.
Right, they call Galala. It's when you conceive. He says it's smaller than the sesame seed oil at the tip of the llama hair, and you check it 7 times. It's still smaller than that, the embryo.
Ah.
The first he said it requires 3 factors. You need to have parents. That means you have to have sperm and egg.
Mm-hmm.
And then mother has to be in menstruating. That means you have to have a healthy womb, microenvironment.
Mm-hmm.
And you have to have healthy ovum, which has a shell as a microenvironment that you can suck on the content and put in your somatic stem cell in there, or you use fertilized stem cell put in there as different persons by utilizing the egg shell. So you have to have the microenvironment as well. And then the third factor is called patisonti vinyana, that means, or kantapo, that means birth consciousness, which also depends on craving, tanha, and karma.
Mm-hmm.
So without the tanha and karma, you don't need that birth consciousness because you cease to exist as a rolling on lives anymore. So, and then he described at the origin as embryo, smaller than the droplet I mentioned, kalala, and then aputta, which is, he said 7 days, become a white dot. It's like a blastocyst that human being nowadays discover. And then a week later it's become a red dot. It's kind of blood tinge, aputta, and then basi. And then there's pachasakha, that means there's 1 head, 2 arms, 2 legs.
Mm-hmm.
And then the next will be a week later will be like with the hair, body hair, scalp hair, and the nail, and so on. And then after that, he said, what mother consume become part of the embryo.
Okay.
So
the
describe
nutrients,
it's matching with
feeding
the current finding, stepwise, weekly.
Of course, there's no part in which the person back then would be
There's no
dissecting.
microscope and nothing. So
And
because
he
of
found
his
out about that.
omniscience, he was able to pervade the universe by understand the universe. He said thing is changing all the time. And nowadays they found that even when you sit still like this, we near the equator would move about 1,000 miles an hour. And then the Earth would rotate around the sun at 67,000 miles an hour.
Mm-hmm.
So we don't feel anything. And in the Milky Way, we move about 100,000 miles an hour. Our solar system move around the Milky Way. And the Milky Way move at 1.3 billion miles an hour. How come we don't feel anything? And because of the rotation evolving, things cannot stand still. That's why we age. It's amazing. So he discovered impermanence or anicca, and then tukkhang or imperfection, and then anatta or not self or selfless or soulless, which is unique to Buddhism history. People back then may see impermanence, imperfection, but not self or soulless, or not or voidness or emptiness are unique to Buddhism.
Let's track back and delve further into the subject of his teaching in relation to now. What's the term? Preventive medicine.
Yes.
How is it so? Is it regarding the teachings in meditation, or is it the practice itself that?
Both. I think the physical aspect come as precepts for the monk to observe 227 precepts for a male monk, 310 for female monk, a little bit more gruesome. But then more preventively is a mental aspect, because the body consists of body and mind, as you know. And then that's why there's form and consciousness. The mental activities of feeling, perception, and thought formation, which are the backbone of how we cling to things. And he said to see your mind, which is formless, solitary, incorporeal, travel far in terms of thought and so on, reside in this cavity or this body. So you have to trace the mental activities, feeling, perception, or thought formation. So to catch that, he gave us a wonderful tool. It's called 4 Foundations of Mindfulness, or Satipatthana in Thai. It's a Mahasathipatthana